Hi, this is Ron. This lecture will talk about rehab for hospice and palliative care for patients that have chronic illnesses. Learning objectives including defined hospice and palliative care, discuss the benefit of rehab for hospice and palliative care, and also describe the rehab assessment and therapy plan for patients that are receiving palliative and hospice care. By definition, hospice and palliative care or medicines is a formal subspecialty of medicine that focusing on symptom management, relief of suffering, and end-life care. It can be divided further into two different kinds of care. For palliative care, it aims to improve quality of life while the patient is continually active treatment through different phases of their life-limiting conditions. In a simple way, palliative care is more like a symptom management of a life-limiting illness. As opposed to hospice care, it is a concept of care designed to provide comfort and support to patients and owners when a life-limiting illnesses no longer respond to curative treatments. Or in hospice care, basically we manage the symptoms and make sure the patient is comfort throughout the end of the life. Palliative care and hospice care is under a big umbrella of chronic illnesses. For example, arthritis, IVDD, other chronic illnesses such as chronic kidney disease, congestive heart failure, or even cancer. I treat quite a bit of cancer patients, and all those cancer patients, they may have chemo-related symptoms such as fatigue, nausea, and neuropathy, and also have cancer-related symptoms such as pain and fatigue. And those are the patients that they would benefit either from palliative care or hospice care. And in my opinion, rehab play a very important role in managing those symptoms or clinical signs for patients with chronic illnesses. So who enters hospice and palliative care? Patients that are diagnosed with life-limiting diseases, for example, cancer is the one that we see the most, especially patients with osteosarcoma, and also other illnesses such as, again, chronic arthritis or IVDD. Those patients may not get better, maybe only for symptom care management at the very end stage of the disease. Decision not to pursue curative treatments is another way that we would see those patients because owner doesn't have the money or the patient's not a good candidate for anesthesia, so they would select to go into palliative or hospice care. Or curative treatment has failed. Signs of chronic illness interfere with the pet routines of quality of life. This commonly is the arthritis or IVDD, that those are the cases that we see the most coming for rehab just to help to make sure that they have a good quality of life and able to function better. And also patients with progressive illness with complications. When patients have chronic disease, generally they may have all sort of other complications such as neuro, musculoskeletal, or even cardiopulmonary complications. And those could result in impairment of functional decline. For example, they may have declined strength, decreased range of motion of the joint, decreased endurance, impaired coordination, balance, and gait. Elderly patients or patients that could not get up and walk, they may have significant muscle atrophy or contracted muscles. So rehab acknowledges that the adage of use it or lose it, right? So if the patient affected by the chronic diseases or cancer, they having trouble walking or they tend to lie on all the time, and you expect that these patients gonna have impairment of their functional mobility. Here's some of the rationale of rehab for patients for palliative and hospice care. To help to relieve pain and clinical signs, to remain or maximize independence with functional activity and mobility, to reduce or control consequences of the illness, to avoid secondary complications, and to optimize and maintain quality of life. And here's what rehab can do for those patients. At least we could help the patient to decrease pain and inflammations using laser, massaging, ultrasounds, and even acupuncture. It also helps to reduce swollen edema utilizing the same modality. It promotes wound healing, especially using laser. It increases mobility and strength, especially through manual therapy and therapeutic exercises. For example, underwater treadmill. It relaxes of muscle spasm. It promotes joint functions and health, minimize muscle atrophy and joint stiffness, and also keep the patient mentally engaged as well. And here I divided the goals of rehab for those patients into 4 categories. The first one is preventive. In this stage, you can utilize rehab during the early diagnosis or the pre-treatment phase of the disease. This phase, it aims at maximizing functional status and strength in order to build up physiological reserves needed to offset the impairments of the chronic disease. So this is the phase commonly, for example, after amputations in a patient with orthosarcoma. So we know that now that patient is walking on 3 limbs. Eventually, this dog gonna develop arthritis in all 3 limbs. So before the dog developed those significant osteoarthritis, we would start to do some rehab or even put the dog on some supplement that help to prevent or slow down the progression of the osteoarthritis. The second phase is the palliative, which can be utilized for the durations or at the end of the treatment. It helps to minimize signs associated with disease and also help to prevent or minimize adverse effect affecting or related to the treatment. It also helps to maintain the functional status as well. So this is the phase during treatments that the patient could possibly causing side effects or maybe have some fatigue. For example, after chemotherapy, and patient can start doing some physical therapy, and that help to maintain the muscle mass and prevent the fatigue during treatment. The third one is restorative, and this can be done for the duration and end of treatment, just like palliative. It aims to restore independent function to prepare to return to normal life. And this is commonly patient with amputation after patient with osteosarcoma. So after amputations, then we know that the dog is walking with 3 legs. So we need to train them to utilize or how to use 3 legs to walk. They most likely not going to go back to their normal life like walking 4 limbs, but they still can enjoy the life. After we strengthen the 3 limbs, they can get up easier and walk better, or even run if they like to. So this is the phase that we try to get the dog back to the normal life as much as possible. The last one is supportive. This is the phase that when the patient has advanced stage of disease or advanced stage of cancer, that we know that patient is not going to get better or is not going to be cured by treatment, or patient that have a very end stage of osteoarthritis. There's no way that we can really help the dog to move better with medications or surgery. So this is the phase that we aim to enable them to continue regular function, at least, albeit with certain restriction and impairment. In this phase, a lot of time we utilize a lot of manual therapy that at least we want to make them to feel comfortable before or until the owner make a decision. So rehab assessment is very similar to how we deal with all rehab patients. We need to know or review the medical history. We need to know the diagnosis and comorbidities. We also need to assess the life quality score, which we'll talk about that later. Since the patient is getting palliative care and hospice care, it's very important that we always or constantly assess the quality of life score so that we are heading the right direction, not making the dog worse. If indeed the dog is getting worse, then we will need to talk to the client about euthanasia. We also need to assess the pain level and also assess the prior level of functioning, especially pre-admissions to your service, so that we know how the dog what's the dog activities before coming to see you, or even before having the disease, what would be the activity that the dogs would do. And based on that, you might need to set your goals either to be realistic, or either you need to tell the owner that, hey, because the illnesses, we're most likely not going to get the dog back to complete normal, but at least the dog can be functioning. Self-care ability is very important because eventually we want every dog able to care by themselves. Get up, drinking, get up, walk, go to pee and potty, lying down without any problems or without any assistance. So those would be the main goal when it comes to rehab. After we achieve that goal, then we can do a little bit more like strengthening work, balancing, and endurance. Okay, and here we also need to assess their functional ability or mobility. For patients that have congestive heart failure or chronic pulmonary diseases such as asthma or pneumonia, then we need to also assess their cardiopulmonary functions, which we're going to talk about in the different lectures about pulmonary rehab and cardiac rehab. And last thing that we need to know what's the owner goals for rehab interventions. So for each rehab assessment and plan of care is patient specific. This is what we always emphasize when it comes to rehab. We need to assess the patient individually and also plan on the treatment individually as well. It has to be sensitive to each patient's signs, functional needs, and also individual goals for treatment. Well, this slide is familiar to you because this is a slide that I always use to make sure I have all my treatments in check. So in rehab, or when you use rehab for hospice or palliative care, so those are the three main areas that you can make sure to look into. So manual therapy, we have joint mobilization, soft tissue mobilization, stretching, massage, range of motions, and that's very good for pain relief, reduce swollen, relieve muscle spasms. Treatment modality, there's a bunch of treatment modality that you can select. Laser, heat cold, ultrasounds, electrotherapy, PEMF, shockwave, acupuncture, chiropractic. And those are very good for relieving pain, inflammation, and also improve flexibility and prevent muscle atrophy, especially when you're using NMES. Therapeutic exercises, all kind of exercises with or without equipment. If you're using equipment, you can use physio ball, cavalier pole, rocket board, treadmills, and then also aqua therapy utilizing underwater treadmill and pole. And those exercises is very important that help to build up the strength, improve the weight bearing, gait retraining, soft tissue flexibility, proprioceptions, balance, strength, and endurance. So again, there's no one size fits all. So you just have to select your treatment plan or interventions based on the individual assessments. Some patients, they may need assistive device. For example, they may need a harness to lift them up or sling to lift them up. They may require joint wrap, just help to stabilize the joints when they're walking. For some cases, you probably would need to use orthotics or braces to get a better stabilizations. Patient that we know that they're not going to get back and walk again, so you might consider getting a wheelchair or wheel cart. And patients, if they have a CP deficit, keep dragging the hind limb due to the weakness or IVDD, then you can consider some devices such as toe-up sling or dorsiflex that help the dog able to walk better without dragging their feet. And this is how the toe-up sling looks like. It's sold by the orthopeds. And dorsiflex, it's just utilizing the similar principles, but it's sold through Therapol company. And just want to give you an example how dorsiflex can really help dog walking. So this is the dog. You can see it's kind of dragging the left hind limb. So definitely that the proprioception is pretty bad. So now, if you put the toe-up sling up, you can see that now it flexes the tarsal joints very well. So the dog, when they walk, it would prevent them from like dragging the feet. Again, if the dog is not walking and you know that no matter what rehab you're going to do, the dog's not going to get back and walk, then you can consider wheelchair. There's two different type of wheelchair. One is custom-made. Here are just three common companies out there that make the wheelchair. Dog on Wheel, Eddie's Wheel, and Citgo. You can also get wheelchair from the shelf or over the counter, but they usually is adjustable even though they're not customized. Walking Pads or Walking Wheel are the two companies that you can easily help the owner to measure the size, and then the owner can purchase it online and then bring it to you, and then you can try to fit it in. Walking scooter, it's a very new stuff that out there that I found is very, very interesting, and I like it. I personally have not had the chance to use it yet, but I think it's a very good idea. So the dog not walking and not a good candidate for a wheelchair, because we know sometimes when you put a dog on a wheelchair, they would not walk for you, or they would just froze. In this case, you might consider getting what they call a walking scooter. It's made by Walking Pads. So there's two types. One is with the scooter. So when the dog walk, they can drag them or drag behind them pretty easily. The other one is without scooter, and this is how a dog looks like in a walking scooter. So let's talk about modality that can be used for patients with hospice and palliative care. Those modality you already learned from some lectures. I just want to give a quick summary on what modality I would use personally when I have a patient that require hospice and palliative care. Cold therapy, the benefit is it reduces pain threshold, also cause vasoconstrictions that help to reduce the circulation, to reduce inflammation. It also decreases muscle spasm, especially acute muscle spasm. Application-wise, you can use iPad, commercial cold pack, cold compression unit. You can do 5 to 10 minutes or up to 15 minutes, but I would usually don't do longer than 20 minutes. And you can also do it after increased activities or exercises, because dogs usually get sore after exercises, or the swollen may get worse. So this would be the time that you can use cold therapy after exercises just to reduce the swelling. Again, cold therapy should be avoided over the area that have poor circulation or poor sensory inputs, open wound, or even mess. You have to avoid putting the ice pack on it. Heat therapy, on the other side, it causes vasodilations, which help to reduce muscle spasm, especially for chronic muscle spasms. It increases local circulations, relax muscles, and improve tissue elasticity. Application-wise, you can easily get a hot pack, or if not, you can just put uncooked rice into a salt and microwave it for a couple minutes with a cup of water, so that the salt or the rice absorbs some water. Then you could use that as a heat pack. You can do 15 to 30 minutes or 20 minutes. It should be okay. You can do it before exercises that help to warm up the muscles. And if you're aiming to do a deep tissues, let's say if you want to warm up a tissue that is deeper than 3 centimeters, then you might prefer using therapeutic ultrasounds. As we mentioned, usually heat pack, the heat doesn't conduct well after like 2 centimeters deep. So you have to use therapeutic ultrasound. Like cold therapy, when you want to do heat pack, you need to avoid area that has poor circulation, sensory input, open wound, or mass. Massage, it's very, very helpful in this for any hospice and palliative care patients, because dogs generally, they love massage. It provides some calming effect and also improve attitude. It improves circulations, lymphatic flow, which is good if the patients have local swellings, either because of the dog's not moving much, or there's a mass that blocked the lymphatic flow. So you can do massage to improve that swelling. It also stimulates both sensory and autonomic nerve. It stimulates release of endorphin, serotonin, norepinephrine, adrenaline, and cortisol. So that's how you make the patient calm. At the same time, you also provide some pain relief. It again improve attitude, improve GI health, especially if the patient has constipation, diarrhea, vomiting, abdominal pains, again, you can utilize massaging around the abdomen area or lumbar area. That's going to help to relieve some of the GI signs and improve GI health. And overall, very comforting as well. So, couple technique of massage include stroking, massage, compressions or ringing, percussions, deep tissue massage, and technique. So those are the techniques that you learn from your session to rehab lab. When it comes to pain management, massage definitely is very important. I always tell the owner to do massage because massage can provide a very good pain relief between rehab sessions. I tell the owner to do at least 2 or 3 times a day that massage all the muscle and joint. You can do it before exercises or even after exercises. But typically, you also need to combine other modality at the same time as well, either TENS unit or PEMF or CC loop. Those are things that owner can do at home. So range of motion and stretching is also very commonly used in patients that have functional disability. Stretching and range of motion, I commonly combine both together. I usually do range of motion first so that you can warm up the muscles and then you can start doing some stretching. Both of them maintain joint health, improve joint flexibility, sustain tissue extensibility, and also prevent adhesions between soft tissue and bone, and also shortening of tissues and muscle weakness. One thing to keep in mind is range of motions and stretching, both of them do not prevent muscle atrophy. So this is one thing, a huge misconception about stretching and range of motions. Some veterinarian, they will recommend the owner do range of motion, stretchings, they can help to prevent muscle atrophy, which is not true. It may slow down the muscle atrophy process, but definitely would not prevent it. The only way to prevent muscle atrophy is by 2 things, right? So one is that you want the muscle contract voluntarily, or the dog contract the muscles themselves. That's the best way to prevent muscle atrophy. Most commonly is the dog standing, walking, bare weight, and that's how you cause the muscle actively contracting. And the other way to prevent muscle atrophy is using e-stim or NMES. Like I said, before stretching, you need to warm up the tissues. So you could use a hot packing for 5 to 10 minutes, doing massaging first, doing some passive range of motions, or take a dog out for a short walk. Once the muscles being warm up, then you can do a better stretching. Okay. For range of motions, I typically combine flexion and extensions together, or you can call it bicycling. Do it slowly and gently, 10 to 20 times per sessions. Or I usually tell the owner, if they don't want to count the times, how many times they do it, just do it 1 minute and rest for 2 minutes and do another 1 minute and repeat that a couple times. And make sure to move all the joints in flexion, extensions, positions. Okay. And don't forget about abduction as well. Sometimes that I would tell the owner to do range of motions through the internal abduction and adductions. Basically kind of do like rotations of the limb, especially the shoulder joint and the hip joint. Again, you can add stretching and massage in between. For the stretchings, do a slow stretch and hold it for 12 to 30 seconds. We usually don't do longer than 30 seconds, mostly because it may cause joint laxity, which will cause instability of the joint. You can do it 5 to 8 repetitions. So stretching, you want to do flexion, extensions. Again, don't forget about abductions. Abduction is more important than adductions. Adduction, usually when the dog have pain, they try to protect themselves. They always do adductions. What they really need is the abduction training, because a lot of dogs, they having trouble abduct the limb. A lot of time that it will affect their balancing. And also look for pain reactions, vocalized, and attempt to bite, because you don't want to do the stretching and the dog become painful. Okay? Again, you can move from range of motion into stretching and back into massage range of motions. So just so that you kind of rotate everything together, the dog doesn't get bored and you're not getting bored doing so. Joint mobilizations, can utilize in patient with palliative care and hospice care. There's a couple types of joint mobilization that would be benefit for patients. Distractions, gonna kind of pull the joint away. You can do gliding and also do compressions. Those are techniques that you learn from your rehab lab. You also need to know the principles of convex and concave when you're doing gliding, right? So remember that if it is a concave, if you glide, the joint gonna move in the same direction. If you're using a convex surface, again, when you glide, you're gonna glide a opposite direction. The benefit of using joint mobilizations include moderate pain, especially if you want to use for pain control, you want to use grade 1 and grade 2. Induce relaxations, improve tissue extensibility and range of motions, especially when you are using grade 3 and grade 4 mobilizations, and also reducing tissue restrictions as well. It can combine with range of motion and stretchings. So you can do range of motion, stretching, couple minutes of joint mobilizations, and back to range of motion, stretching, and joint mobilizations, for example. Exercises wise, again, it depends on if the patient is ambulatory or non-ambulatory, so you might need to design your exercises a little bit differently. If the patient is non-ambulatory or paresthesia, I would start with massaging, range of motion, stretching to kind of warm up the muscles. I would do some assisted standings. When the dog is standing, I would do some weight shifting, back and forth, left and right. And then for a couple minutes, then I'm going to do some bicycling while the dog is assisted standing. Then you can go back to weight shifting and bicycling and do it for a couple minutes. Okay. At the same time, I might also add in toe pinching. So pinch the toe while the dog is standing. There's two benefits. One is that when the dog lifts one leg up, they may shift the body weight to the other leg. So it will be benefit for weight bearing training of the opposite limb. So on the limb that you pinch it, actually that you will activate the muscle contraction. Sometimes I play tug of war with them when you're pinching it, so that they will like keep pulling the limb. It's not exercises for or inducing active contractions, right? Like I say that contraction is very important for preventing muscle atrophy. So this is actually good exercises that you're causing the dog have a voluntary contractions. You can do assisted walking. After assisted standing and warm up the muscle, then you can use a sling or harness and just help let the dog walk for a couple minutes. Of course, in your facility, you can always utilize underwater treadmill. The water level might be at the hip joint, which take up 60% of the body weight. Positioning is very important too, because eventually you want to train the dog able to, from a lateral positions and transition to like sternal positions and then sitting position and get up position. So this is the transition that you want to train the dog so that they're able to do it, and eventually, hopefully that they will able to do it themselves without any support. So when the dog is lying down, you want to like transition the dog to sternal. Usually I will use a harness to do it. When the dog is on the sternal positions, I will do some rocking. So just kind of activate some of the muscles in the front limb and back leg. And then slowly push them to a sitting position. While they're on a sitting position, then I will start to push them to get up to a standing positions. Then you can do it a couple times. Lying on the left side, do one time. When the dog lying on the right side, and then you do another time as well. Bladder compressions, which is very important, is the patient having trouble urinating themselves. In this phase, also using acupuncture and MES laser and PEMF, and that could help for pain relief, stimulating the nerve, preventing muscle atrophy. So if the dog able to bear weight, then you want to encourage them bear weight more, especially that dogs have a surgery or again have a very bad chronic arthritis, IVDD. So those are exercises that you can consider: weight shifting, off balance exercise, cookie stretching, side stepping, obstacle course, foreign object on opposite foot, 3-leg standing, and underwater treadmill. So that's cookie stretching. If you want to do exercises to improve or maintain balance and proprioceptions, And here's some of the example. Rhythmic stabilizations, that the dog stand on the ball and doing some rhythmic stabilizations. If the owner doesn't have the ball, just tell them to get bouncing disc or just put the dog on a pillow or trampoline. They can do off-balance activity. You can also do circling or figure eight. That's gonna good for balancing and core muscles. They can do cavaletti, vertical pose, obstacle course, and sidestepping. Strengthening muscles or core strengthening. So you can do sit to stand, which you have to strengthen the hind limb. Sit to down, strengthen the hind limb and the front limb. With the front limb standing on an object, either it could be a chair, it could be a pizza ball, and just gonna help to strengthen the hind limb. So this is the thing that you can do in your facility. But again, nowadays owner can buy the physic ball pretty easy online, on Amazon. You just have to teach the owner how to do it. If you want to strengthen the front limb, you just kind of put the hind limbs on the object, chair, on physic ball. Okay, it is not that common though, and you need to make sure that it's not too high when you put the hind limb on objects. I usually use stairs. Just let the dog hind limb step on one or two stairs so that it's not putting too much stress on the front limb. Leg weights or TheraBand is another exercises that can utilize that help to strengthen the muscles. And of course, underwater treadmill is a very, very good modality for strengthening. Exercises to maintain and improve joint range of motions. Again, you can do range of motion stretching. Sit to stand is very, very good for range of motion on the hind limb, especially hip, stifle, and tarsus joints. Lie down to stand up, not only good for the hind limb, also good for the range of motion on the front limb. You can do cavaletti. You should know by now, cavaletti is very good for range of motion of the elbow, cuff joint, stifle, and the tarsus joints. Not much on the shoulder and hip joint because dog, they don't move that much. Hip, they may have an increased flexion when they walk over cavaletti, but it's probably not the main reason why we want to use cavaletti to improve hip flexion. Incline and decline walking, stair climbing, again, underwater treadmill is very good for improving joint range of motion. So, other modality that can utilize or commonly utilized in patients with palliative care and hospice care is acupuncture. I use it a lot because most of the palliative care and hospice care patients, they need additional pain relief. So acupuncture can definitely help with that. Relieve pain, regulate immune cells, immunity, inflammations, relax muscles, nerve stimulation, and also have a calming effect. You can do it weekly or monthly. When it is a mass that you're treating, you need to avoid needle the malignancy area. Myofascial trigger point release, to me, it's super important, especially that patient having trouble walking or they tend to have muscle spasms. They always have myofascial trigger points. This would cause myofascial pain, restrict movement, and muscle weakness. Okay. How do you diagnose myofascial trigger points? Basically using your hands, right? So you just have to use your hand, kind of run across the muscle belly or any kind of muscle to find if there's any knot. Once you find the knot, again, there's a two way that you can release it. You're just gonna press it and release it. Press it and release it. Or you can just grab it and just kind of slide it in. So this is actually the way to diagnose trigger point, but also is a good way to release the trigger point as well. So once you find it, you can just keep doing that to help to release the myofascial trigger points. There's a lot of other ways that to do it. Massage, I tend to use myofascial release technique, just kind of stretch out the muscles, or even just basically stretching the joints. When you stretch the joint, you're going to stretch the muscle as well. That's going to help relieve some of the trigger points. Or you can utilize acupuncture, dry needling, laser, Doppler ultrasounds, or even shockwave to help to release the myofascial trigger points. Laser, we're very familiar for its benefit, which increase circulation, decrease inflammation, decrease pain, and promote tissue healing. We tend to recommend 5 to 15 treatments within 3 to 5 weeks, and then weekly or monthly. This would also based on what the company recommends for the treatment frequency. Again, we usually avoid using laser or malignancies. Electrostimulations. So by now you should be able to differentiate TENS and NMES, right? So TENS, again, it's for pain control. So it depends on what kind of pain it is. You select different frequency. For acute pain, we recommend 80 to 150 hertz, which is a higher frequency. For chronic pain, we use a lower frequency, 2 to 10. Some books say that is 2 to 20. Okay, it doesn't matter as long as it is lower than 20 hertz. For strengthening muscle, which is E-stim or NMES, we usually use 35 to 50 hertz. The way that increase the setting, it also depends on how the patient could tolerate. Okay, in general, greater intensity stimulation provide a higher level of analgesia, but you don't want to go too high that the dog could not tolerate that. You still need to base on the comfort level of the patient when you turn on the intensity. But again, we usually turn it up to the point that patients can feel it, but it does not cause any discomfort. Frequency-wise, you can do it 20 to 30 minutes per treatment. You can do it 3 to 7 times per week. Okay. When it comes to pain control using electrostimulation, I always emphasize that TENS units generally it's for symptom care. We use that when patient has pain. If the patient does not have pain, most likely they're not going to respond to TENS treatments. Okay. NMES, you can use it once a day if the patient is paralyzed or until the dog able to get back and walk again. And TENS and NMES is the modality that you can tell the owner to buy the machine online. Just tell them what brand you want to use it. TwinStim is the one that I commonly tell the owner to buy it and bring it to the appointments, and then we'll set up the 10-15 minutes of sessions with the client so that I would teach them how to use the TENS unit and NMES at home. Pulse electromagnetic field therapy, or PEMF, is commonly used for relieving pain, improve blood flow, and improving wound healing. The one that I use commonly is a CC loop. So I use that 2 to 3 times over 50 minutes per day over the painful area and up to 2 weeks, or until I'm satisfied with the pain level. Then I will do 2 to 3 times weekly for maintenance. Again, PEMF, it can be easily applied at home by the pet owner. For assisted loop, it needs prescription, so I just give the prescription to the client and they can buy online, or then you can also sell them through your clinic as well. So last thing is quality of life assessments. Remember that those patients coming in for palliative and hospice care, so you need to assess the quality of life pretty often. If for very severe cases, I might assess that every other day. If the patient is pretty stable but it's not completely out of the blue yet, and I would do it weekly. And if the patient is pretty stable but is still need long-term treatment, and I'll do monthly assessments. And those assessments can be done by the client. It doesn't have to be done by you. Okay. Ideally, when you select a form for assessing quality of life, you need to have a form that able to capture maladaptive pain, also able to capture emotional, behavioral, physical status, and relations with owner, or response social with the owner. Okay. So there's a 4 scale that I like to use. One is the HHHHMM scale that you can search it online. You can easily find it. The other one, especially for cancer pain, which have been validated in a study decades ago, is called Cancer Pain Quality of Life Assessment. If the dog have a chronic arthritis, then you can consider CBPI or Gulf Quest, which is designed by Glasgow University. Another great tool is the Vetmetrica HRQL, which stands for Health-Related Quality of Life Tools. This is a online tools that you can go to the website and sign up for an account. It's for cats and dogs. It's valid and a reliable instrument to measure quality of life of patients, especially that patient with chronic pain, because it has been validated in 2 different studies. This account does charge you for a user fees. If the owner interested in it, I would recommend that look into that, and so that they can document the quality of life score for their pets. So they're gonna have 22 questions. It lasts about like 5 minutes to finish up the questions. It basically asks 2 main areas: physical well-being, which is the energetic and enthusiastic of the patient, active and comfortable level of the patient. The second area that it assesses is emotional well-being, which is how happy the dog is, how content it is, and how calm, how relaxed the patient is. And then once they have all the data, over time, you can actually click on the data and look at how was the dog doing for the past week, for the past month, for the past couple months. If the quality of life is getting better and better, meaning that the dog is feeling better, your treatment is working. If the dog is not getting better or getting worse, then you know that your treatment is not working much. So either the dog needs more out of treatments, or it's probably the end of the life that you need to discuss about euthanasia with the client. So if you don't want to pay for any money for using the website, there's a couple other things you can look into, which is free. Gray Muscle is an app. I believe it's designed by Lab of Love Veterinary Hospice company. So used for dogs and cats, and then you can download it, and then you can just easily put down how was the day of the pet is, good, neutral, and bad. And then you just kind of do it every day. And then when you look back, you would know that how many good days the pet has and how many bad days the pet has. So you kind of compare those to see what would be your next step. If the dog having more bad days than usual, then it might be the time to discuss with the client about quality of life. Other 2 scales that you can find from the Level of Love website is the Dr. Gardner's Pet Quality Life Scales and Dr. McVetti Pet Scale as well. So in summary, palliative care and hospice care is pretty much unavoidable in veterinary medicine, especially that patient getting older, or patient have cancer, patient have chronic diseases. They always cause some impairment for the patients. It could be a pain, it could be impaired functions, and most importantly, it's going to decrease the quality of life of the patients. Rehab, although it's a new specialty, but in human side, they utilize rehab a lot to help patients with palliative and hospice care. So to me, it is important that we consider rehab is an effective multidisciplinary approach in patients that need palliative and hospice care. Okay. What rehab does is help to maximize both comfort and function level of the patient. For rehab therapists, when you are dealing with patients with hospice and palliative care, we need to make sure that to continuously assess the patients to make sure that all goals are relevant and realistic. And by assessing the patient continuously, we're also able to know if the patient is declining, that we need to take further steps or further discussion with the client. So because rehab for palliative care and hospice care in veterinarian is new, so we still need to do a lot of educations, understandings, the role of the rehab, and also possibly do more research on this area and to see how rehab would really benefit for patients that require hospice care. This is the end of my lecture. Thank you. If you have any questions, feel free to email me. Bye.